Hello everyone, my name is Simran and I will be starting over the presentation. So today the special population assignment we will be discussing the spinal cord injury. So my group name is Akal and my group members are Simranjit Kaur Sohal, that is me.
Hello everyone, my name is Jobandeep Singh.
Hello everyone, hope you are all are doing well. My name is Sarleen Kautillo.
Hello guys, my name is Siddharth Singh.
Now I will be discussing the topic name and the introduction of the topic. So the spinal cord is the primary connection, that is the neural communication. So it happens between the brain and the rest of the body with the electrochemical events. The injuries in spinal cord are known as spinal cord injuries. Also, it is known as SCI. So these injuries may result from trauma or disease. So trauma such as car accident or any act of violence and falling. So in the next slide, the table, it shows the high risk of getting the illness. So the males are most at risk in young adulthood, that is from 20 to 29 years, and old age, that will be 70 plus. Whereas females are at most risk in adolescence, that is 15 to 19, and old age, that is 60 plus. So in this graph, it shows the percentage. So the age group and the gender is listed in the below, and it shows the colors also. So the female, the male, and how much, in what age they are at the risk of getting the illness. So now I will be handing over to Joban, and he will be discussing the physiological and anatomical changes.
So now we are going to move forward, and now I will be discussing the physiological and anatomical changes. So first of all, I will be explain you the physiological changes that occur after the spinal cord injury. In this, first of all, we will talk about spinal shock. Spinal shock is a shock of spinal cord. In this, the area below the injury loses its senses, and the blood flow also stops at the site, due to which there is no movement of the spinal cord below the site of injury. This can may lead to the permanent damage of the spinal cord. After this, we are going to talk about bowel control and changes that are occurred before because of the spinal cord injury. After the spinal cord injury, person may have constipation or diarrhea. To treat this, we can use any medicines prescribed by the doctor or any outside digital stimulation, or we have to develop a bowel training program to help the client out. This can be painful, but with a proper treatment, we can properly treat this problem, and we can help the client. After this, we are going to talk about pain all over the body. As you all know that after injury, we have pain in one area, but it can travel to different parts of the body. So this is same in the spinal cord injury also. After the injury, there is a like injuries in one part, but the pain goes all over the body. So there can be internal or external pain in different muscles and joints all over the body. Also, there can be pain in the back that can travel from back to the legs and then to the feet. So to treat, we can do some simple exercises like stretches so that our body remains activated all the time and the muscles do not lose their movement. After that, we will talk about brain injuries, as there is no movement of neuro signals from the spinal cord to the brain because of the damage to the spinal axons of the spinal cord because of the injury. As the injured site is swelled and at the axons at that position are not conducting any nerve signals, because of which the nerve is not conducting and thus the signals are not traveling to the brain, due to which there may be some injuries like brain hemorrhage, which is very dangerous and it can cause the death in also. Now, in the next slide, I'm going to talk about anatomical changes that occur after the spinal cord injury. In this, first of all, we will talk about demyelination of axons, which means that the axons are demyelinated or the upper covering of the axons is removed or dissolved, due to the which the axons becomes exposed So it becomes dangerous for the body as the neural signals will not be able to travel from one part of the axon to the other, and they can strike the axon, due to which the permanent damage to axons can occur. After this, we will talk about swelling in the spinal cord, as the blood is not properly flowing through the spinal area, and thus that area is becoming swelled. Due to this, that area is not able to conduct any signals. Third one is the blood clots, as the blood is collecting in a specific location, which causes a swelling at that area. This blood collects there and takes the form of a blood clot. This clot does not allow any signals to travel through the axon. Due to this, the signals are not able to reach the brain, which can also lead to blood clot in the brain. This is the main reason that causes a brain hemorrhage in people with spinal cord injury. And the last, we have the damage of the nerves. These can be there can be like stress on the nerves, as sometimes due to spinal cord injury, they can shrink or they can dilate, which lead to the damage of the nerves. As because of this, the stimulus control system of the body is not working properly, and thus lead to major disease of spinal cord in the body. So now I'm going to hand over to Simran.
Okay, so I will be talking about the exercise recommendations now. So, the people with SCI, so they can take part in exercise, which depends on the level of spinal cord injury. So, there is no dramatic difference in terms of training, intensity, duration, or frequency. So here's a table that it is recommended by US Department of Health and Humanitarian Services. So it shows the time, the training type, and the intensity. So it can be 150 minutes a week, and it can be the type can be aerobic training. So the intensity will be moderate intensity, or it can be 75 minutes a week, which will be the training type will be combination of moderate and vigorous intensity. So the intensity will be light to moderate. So with the exercise, gripping is also recommended. So which are straps to do the exercise, such as lifts or cardio, such as for treadmills. So the main reason for providing straps is to increase work effort of a person with spinal cord injury. So now we will be sharing the screens so that we can show you the video that we have found out.
Finally able to stand in the parallel bars, pretty much supporting my whole self, and I'll keep working on that at home. So it feels really good. 4 hours a day we have mapping, which is basically optimizing the electrodes to fire in such a way that I can get volitional leg movement. And so that takes up a lot of time and effort, and it's just tedious but worth it in the end, because you can kind of see yourself progress slowly as the time goes on. And then usually once a day I'll have physical therapy, and we do more standing there, lots of standing, and occupational therapy to train my upper body, which is vital to support my core. So I'm able to do various movements with my legs. I'm able to support myself standing. My core strength, we have a program to kind of stiffen me up so I can sit up straighter and train my core with that. So overall, a lot of good improvements. Facility is great. Rooms are huge. There's plenty of room for you and whoever you bring. And the nursing staff is very helpful, super polite. The food is good too. It's not like hospital food you would find anywhere else. So I'm really happy with it. Super clean, spacious. The time I just go for it. I just wake up with the mindset to push forward. I've never really had an attitude about quitting. And even if I do have an off day, I just kind of think about how far I've come since the beginning and how far there is to go still. And that helps motivate me. My blood pressure is improving. I've been able to stand for longer periods of time since we've been here. I've noticed more muscle mass in my legs. From day one to now, my legs are a lot stronger than they were. I'd say jump in with both feet. Don't test the waters. I mean, it's proven. You can see videos. You can read papers. I did a lot of research before coming here. I was researching this for 6 months, maybe more, just making sure it was the right option. And you can't really go wrong with it.
So now we will discuss about some current best practices, such as you can see we have neuroprotective pharmaceuticals, regenerative pharmaceuticals, cellular transplantation with the implantation of structure scaffolds. As you guys know, spinal cord injury is a degenerative disease that causes
I'm feeling a lot better and great.
An important neurological impairment. It is a medically complex and life disrupting condition. Spinal cord injury has a devastating impact on international health system due to its irreversible consequences. The lack of efficient treatment affecting mostly young population with their productive years. Firstly, we have to avoid the pressure source and potential risk areas, and these should be checked frequently. Individuals with complete quadriplegia who have no sympathetic innervation to the heart and their maximum rate may only be 115 to 130 beats per minute. The unfit clients will suffer from peripheral fatigue before any central training that has any effects. When beginning an exercise programs, the sessions should consist of short bouts of 5 to 10 minutes at a moderate intensity. The alternate activity with 5-minute recovery periods is mandatory. This training method should also be used in quadriplegics due to their minimal amount of active musculature. And there is a broad spectrum neuroprotective and regenerative compounds that exert their potential disease modification and that affects by protecting the neurons against any cell toxicity, inducing the brain network regeneration, and maintaining the functionality. The spinal cord injury is often characterized by immediate and irreversible loss of sensory and motor functions below any level of injury. The cellular transplantation in various experimental models of spinal cord injury has been used as a strategy for reducing deficits, and improving functional recovery. The general strategy has been aimed at promoting regeneration of intrinsic injured axons with the development of alternative pathways that facilitate a partial function correction. And the other objectives of cellular transplantation studies have included the replacement of lost cellular elements, the elevation of chronic pain, and modulation of the inflammatory response after the injury. Now, I will be handing over to Siddharth.
So I'm going to discuss about the challenges of spinal cord injury. So there should be an organized peer monitor programs to the clients in which the client should be educated about the disease they are facing with and what are the outcomes of the disease and how they can maintain it. Moreover, they should be educated about the medical outcomes of what the medicines are they are taking to cure the disease. Basically, the medicines have a lot of dangerous effects. It causes like obesity, moreover any other problems. In spite of using medical precautions to the client, indications to the client, we can recommend them healthy exercises in their routine schedule, so that they can do that in spite of doing medical indications. Moreover, they should involve in some kind of physical activities to get distracted from the things they are doing for or the disease they are facing with. That will help them to build up self-confidence in them, and the problem will be cured sooner. And the next, I want to discuss about the workout plans. So basically, we have 45 minutes of workout plans in which we have discussed many exercises, starting from the stretches. Well stretched muscles and flexible joints will help prevent strain and injuries. Spinal cord injury causes our muscle to tighten up, and the best way to prevent that is to stretch and move our joints through their full range of motion. So we should try to hold our stretches for 30 seconds or until the tension goes away. Stretching should not be painful, but never force anything against your body's natural resistance. So we can recommend some of the stretches such as yoga. We'll be doing it for like 2 minutes, laying on your stomach for 2 minutes, using a standing frame and exercising bands for 2 minutes. And quadriceps stretch, calf stretch. We'll be holding these for again like 30 seconds. This will help the person or the client to stretch and flex in their body more and more so that they can involve more in the physical activities and they can enjoy them with a good, fun, and entertaining way as well. Moreover, we do recommend some type of aerobic exercises. Aerobic exercises are great for overall lung and heart health, especially if it's performed to the point whereby the individual is out of breath and sweating to an extent. Each session should include a warm up and warm down to avoid further injury. Circuit training for like 2 minutes, treadmills for 3 minutes, arm or bicycle ergometers for 4 minutes.
And now we will discuss about some of the leg extension exercises. And these are mainly for people who are sitting on wheelchairs. And while performing these exercises, firstly you have to perform 10 reps for each leg before moving on to the next exercises. And it will be beneficial if to add weight to increase the difficulty. And for leg strengthening exercises, we have recommended kicks, hip flexion, and hip adduction. And some of the another like upper body and shoulder exercises that we have recommended are like jogging arms, and we have recommended it for like 4 minutes. Arm circles, it's also for 4 minutes. And lateral raises, wrist flexion and wrist extension for 3 minutes. And then we have recommended shoulder rolls for 4 minutes, The overhead shoulder stretch for 1 minute, the shoulder shrugs for 2 minutes. Like we have planned this workout plan for 45 minutes. So we have given each and every exercise, we have recommended the time of each and every exercises according to the time. And these are the easy exercises that can be performed in the at the home too, and anyone can easily do it while living at their comfortable space. So this is all for our presentation. Thank you so much.